Just when you thought the whole issue of whether or not to close a PFO was complicated enough, now there is an interesting report in circulation that indicates that if you have a right-sided endocardial lead, the presence of a PFO increases the risk of stroke or TIA. What the researchers did was take 6,000 patients that had right ventricular leads, and of those did echocardiograms and found 364 that had PFOs. It turns out that the risk of stroke in patients with PFO and a right ventricular lead is almost 3 times the risk of stroke if you don't have a PFO. The difference between the two groups was 8.2% stroke risk in the PFO group versus 2% in the non-PFO group. The take-home message here is that there seems to be a definite correlation with the risk of stroke if you have a PFO and a right ventricular lead. What it means clinically is that patients who have a right ventricular lead ought to have an echo, and if they have a PFO, consider anticoagulation or, of course, closure. For CardioSource, I'm Peter Block.